lung cancer can present in various ways. Now, when we look at the presenting complaints, the commonest presenting complaint is a persistent a cough that does not go away, and a cough which persists despite all kinds of treatment. Right. Along with that, there may be blood coming out in the sputum. Now, these are two most important and visible kind of symptoms, which immediately bring attention to lungs as the source of the problem. Later on, when the disease goes beyond the lungs, you can have pain in the chest. When the disease spreads to what is called pleural cavity and you have fluid filled up in the chest, you can have breathlessness. When the disease goes to other parts of the body, you can have bone pains. Disease goes to the brain, you can have convulsions, you can have vomitings, you can have persistent headache. And side by side, as the cancer grows in the body, you start losing appetite, you start losing weight. So these are all various symptoms which the patient can be present with. More importantly, this can also be diagnosed in a very early stage by using something called low dose CT screening of the at-risk population. So from the US data, we knew that 55 plus population, which has been smoking for over 25 years. So they call it 55 plus with 25 pack years history of smoking. They identified that this was a at-risk, high-risk population. And they did an yearly screening with a low dose CT scan for 3 consecutive years, detected early lung cancers asymptomatic before they could develop symptoms, and treated them aggressively. And they reported a 20% decline in lung cancer related mortality in this population. So low dose CT screening of at-risk population is an accepted, recognized, proved, useful tool which can be applied to at-risk population to detect early lung cancer. So many times what happens is that by the time you develop the very first symptom, it actually goes to already stage 4, metastatic stage is there. Because what happens is that, tumor grows in the lung, it only causes occasional cough. Now, most of us have this occasional cough, so we tend to ignore it. And then slowly it spreads. So patients can present with just 1 day, 2 day history, and you do a PET scan and you find that it has spread all over. So from asymptomatic being picked up to symptoms of chest, of cough and blood in the cough, to various symptoms, to being picked up even without symptoms in metastatic stage, you have a whole range of presentation. And that's why I say awareness that lung cancer is a major public health problem today is important, because if people are aware, they would go and get the investigations done. So at least some shifting. Today, 20% early, 80% late. Our dream is 80% early, 20% late. But that movement has to start somewhere. For that figure of 80 to become 20, it first has to become 70 and 60 and 50. So let's start that movement by raising awareness.